More concern this morning about the Zika virus. The Surgeon General says that there's been a case of the virus reported in St. Johns County. This is the first local case, now bringing the total number of cases in Florida to 14 in 6 counties. Just this week, Governor Rick Scott signed an executive order declaring a public health emergency in several counties. All of the affected patients in Florida had recently returned from traveling overseas. So joining us more to speak about the history of the virus is Dr. Cho Kelly. You are a history professor and you really know a lot about the history of the virus and where it started. So talk to us, why is this Zika virus becoming such a big concern and why now?
It's becoming a big concern right now, mostly because it spread to Latin America and South America, and so it's moving rapidly through the population because in many cases this is what's called a first exposure, and so they, biologically and in terms of their immune systems, they don't have any sort of immune knowledge about the disease. The other thing is that, it has moved out of Africa where it was discovered in 1947, and it moved silently for decades throughout South and Southeast Asia, and then it wasn't really until the early 2000s where there were a couple of major outbreaks in Micronesia and then in Polynesia in 2013, 2014, and then it spread to Brazil.
What is the main factor of the transmission of the Zika virus? Because a lot of people are now concerned because we have learned that it could be passed sexually through intercourse.
Right. So the sexual transmission is a minor factor in terms of the spread of the infection. It is a viral infection that is spread from the bite of the Aedes aegypti and albopictus mosquitoes. And so you're more likely to catch it from a mosquito bite than you are from sexual transmission. Our sexual transmission cases are, I think so far, there are only 3 that are known. And so we're sort of waiting and watching as far as that goes.
So you mentioned that Zika started in Africa. How do you think it spread to where it is now?
It spread to where it is now because of travel, because of movement, because people, we go places, and sometimes when you have enough people that are moving between different parts of the world, then a disease can spread. And since the Aedes species of mosquitoes are prevalent in all of these zones, that makes it then even more readily spread because it's then able to bite a person and then bite the next person, and then that's how you transmit the infection. Microcephaly,
a huge concern here. Talk to us about how that became discovered, and it's really just been a long time without a cure.
The microcephaly issue is a very big issue, and it's a significant one. The problem is that we don't actually know if it is caused by Zika. The other issue with the microcephaly is that it's happening in Pernambuco state in Brazil, which is a large and very poor and impoverished part of the nation. And so there are other factors that medical teams are looking into. So the World Health Organization, as well as the CDC and various other institutions such as the London School of Hygiene and Tropical Medicine are examining the connections between Zika and microcephaly. And so far the evidence isn't pointing toward causation. It seems to be primarily association, and association isn't necessarily the trigger. There may be other underlying conditions, there may be other health issues or other diseases that are triggering this, and maybe there are concurrent infections.
Well, thank you so much for joining us this morning with your insight and a lot more questions that we'll be asking you about this in the coming days. And for the latest information on the spread of the Zika virus and how to protect yourself, you can head over to our website, news4jax.com.